She is an elderly lady who has got this dense mature cataract, and let's see how difficult it can be to divide these nucleus. I'm starting with the rexis already being done. Usually I don't perform hydrodissection in eyes with mature cataracts, but in this case the nucleus was almost sticking out of the bag. So I was not sure whether the nucleus is mobile, so I'm doing a gentle hydrodissection, tapping the nucleus down, then using my Sensky hook to just rotate the nucleus and to confirm that it is free from its bag. OVD is introduced into the eye to safeguard the endothelium. Time to phaco the nucleus. I'm going in with my chopper and the phaco tip. It is a balanced tip, and I'm going to use just the torsional ultrasound energy to do the sculpting. The energy, as you can see, is set up to 90% in linear mode, and I'm going to create a central deep trench. Later then I'm going to do direct chop. So this is a trench and chop technique which I'm following now. The idea to make a central pit is that we get access to the central core of the nucleus, from where we can grip the nucleus very well to perform our vertical chops. So I feel that a reasonable depth has achieved, and I'm going to switch to the chop mode. I'm not going to use the horizontal chopping in this case because there's hardly any space between the nucleus and the posterior capsule. So introducing the chopper through the equator is going to be a little bit intimidating for me. There's a reason I'm sticking on with the direct chop. As is the routine for me, I'm going to use just the longitudinal energy for gripping the nucleus. Short burst of phaco energy is used to grip the nucleus. The vertical chopper goes down vertically, and then lateral separation maneuvers are being done. The chopper is being progressively placed at deeper planes. 2, 3, 4, and 5. In spite of 5 attempts with the chopper being placed deep into the pit, there's still a small bridge of posterior plate which is still attaching the central part of the two heminuclei. It just demonstrates the tenacity of these leathery fibers of the posterior plate. In some areas, that's the central part, it's just refusing to give way. The nucleus is rotated and the same vertical chop is continued. At the bottom, there is an attachment which refuses to give way. I move on to the next piece and the vertical chopping is continued, but the story remains the same. The superior 80% of the fragments are being separated, but the bottom 20% are being held strongly by the posterior plate. So I'm unable to separate them. So how do we proceed with the case now? The plan now for me is to start debulking the lens. That is, I just want to eat up all the superficial segments of these fragments until whatever I can, just leaving the posterior plate as it is. The idea is by debulking the nucleus we can create some space, and then we have an easier chance of maybe flipping the nucleus around and then maybe phacoing the base. So now about 40% of the nucleus has been eaten out, and we still have a large 60% of the heminucleus still in the bag. Time to replenish the OVD. This time I'm switching my sharp chopper to a horizontal one. Since the bag is empty, I can pull the nucleus towards me and then engage the equator with the horizontal chopper, and then it's quite effortlessly to divide the nucleus again until I reach the bottom, where it is again difficult to separate this posterior plate. There is this one band which is acting like a bridge between these two fragments, and it is refusing to give way. Ultimately, I had to just manipulate with the chopper itself to snap the ties. OVD replenished once again. This fragment is consumed. Now we're left with two large pieces in the bag. These two triangular shaped fragments are attached at the apex. With my second instrument, I'm just lifting these fragments out of the bag and stationing them vertically so that my phaco probe gets access to the posterior plate which is holding these two fragments together. So as I phaco the portion which is accessible to me, I thought the job is done. Little did I realize that it's not done yet. There's still some leathery fibers which are sticking around and are refusing to go. So again I come out, I'm trying to inject viscoelastic and try to separate them with the viscoelastic itself. It doesn't work out. The nuclear fragments are then flipped so that the posterior plate is in direct view and accessibility. I go in with my phaco probe and use the torsional energy to eventually divide them into two fragments. Then finally, these two individual fragments are emulsified. Please note that I'm using a linear energy delivery. I'm using predominantly the torsional component with the IP on. And because the energy delivery is very well controlled, I can minimize the amount of turbulence and I can have excellent control in the way the fragments are being emulsified. This helps me to emulsify them in a much more posterior plane. So the toughest part of the job is done. Cortex aspiration lens implantation is as usual and the case eventually is done with. And that's the completion of surgery and the patient did well. Now let us rewind and see a few take-home points for me. If I had another chance in this case, would I have done something different? Well, I think to begin with, if I'd anticipated that the posterior plate was so deep, I would have probably resorted to a stop and chop technique, wherein a deep initial trench of about 80%, and then I could have had two heminuclei, with the posterior plate being broken in the first instance itself. The struggle would have been lesser, because I would have had more space within the bag. Even for the first heminuclei itself, probably I would have decided to go ahead with the horizontal chop. So these are the few things which I would have done differently. Hope you found this helpful. Thank you for watching.